same thing is explained in the commentaries that doshas take shelter, doshas make sthan samshraya in that particular dhatu and produce certain symptoms, and that's why we call it as rasadushti janya vyadhi. But obviously it is caused by vat pitta kapha only. In Sushrut Samhita also, dosha dushiteshu dhatushu. So therefore, what is the difference between rasa vruddhi, rasa kshay, and rasa pradosh? So we can say that vruddhi and kshay are more linked with quantitative aspects, but dushti is always associated with qualitative aspect. In dushti, not necessarily vruddhi or kshay will take place. The quantity may remain the same, but the functions will change because qualitative changes, that means gunatmak parivartan, qualitative changes have taken place. Guna of the rasa are not the same, and that's why abnormalities are observed and diseases are produced. That is called as that particular dhatu dushti, or in specific rasa dushti. So this is the difference between rasa dushti and rasa kshay and vruddhi. So dosha dushita dhatu, dushita. Dushit means abnormalities produced by doshas. Dushti means abnormality produced by doshas. So when abnormality is produced, abnormality in the sense of qualitative changes mainly, then that is called as dushti, or that is called as dhatu pradosh, and in specific rasa pradosh. The same thing is explained in the commentaries, and these are the rasa pradosh janya vyadhi. I am not going in details of that, because to explain that it will take a long time, but take a very good look at all the list of these diseases, and then when practically we find the cases, how we come across these symptoms in those patients, that we can observe. So ashraddha, aruchi, asya vairasya, arasanyata, etc. Pandutva, again this is very important. Pandu also is rasa pradosh janya vyadhi in majority of the patients. Rasa dushti is the cause for pandu. Since rasa dushti is there, the dhatu which is next to rasa rakta and the other dhatus are not formed properly. Remember that pandu is not just anemia according to Ayurveda. In pandu, the dushas include not just rakta, but mouse, med are also involved in that. Indriya also are affected, and oj is also important dusha. So that's why our concept of pandu is a broad concept. Anemia is just part of it. Anemia is not pandu as such directly. Anemia is part of pandu. Okay, but pandutva is very much linked with rasa pradosh. So therefore, in pandu, and pandu, when a person gets pandu, you can go through the list of symptoms of pandu. Again, pandu can lead to various other diseases again. So that's why rasa dushti to pandu and pandu to many other diseases. That also we can find in many patients clinically. Then again, srotasam rodha. This is very important. So when rasa pradosh is there, srotorodh occurs, and this srotorodh can lead to number of diseases. And to treat those diseases, we need to remove that srotorodh. We need to make the srotas clear and sroto shuddhi. And this is because of rasa pradosh that can happen, and that's why rasa shuddhi should be performed. One great personality in the field of pharmacology, Dr. R.D. Kulkarni. Once I had an opportunity to interact with him. He was in Mumbai. He was head of pharmacology department. So he told that the concept of sroto shuddhi in Ayurveda is very, very important. And he told that our doctors, that means modern doctors, they are giving medicines to block the channels. And he said that it is a grave mistake. After a few years, they will realize that what grave mistake they have done. Because Ayurveda advocates about sroto shuddhi, and they are blocking the srotas, blocking the channels. So he said that this should not be done. We should be very careful about that. So he studied Ayurveda in depth, and he was very much affected towards Ayurveda. So srotasam rodha, this is also very important. Even klaibya. So even in infertility patients also, we have to start from rasa pradosh in many patients. Krushangata, nasho agnehe. That means agni mandya. If agni is not functioning proper, am will be formed and rasa dushti will take place. Again, rasa pradosh takes place, then further Agni is affected. So they affect each other. So Nasho Agni, Akala Vali Palit. So even the changes, aging changes, geriatric problems, they are also linked with rasa pradosh, and that we need to understand. And in Sushrut Samhita, it is told about how aging takes place. In that, it is said that Saeva Annarasaha Jarapakva Shariranam Aprenana Bhavati. In old people also rasa is produced, but it is not able to provide proper nutrition to dhatus, and that's why geriatric changes take place, aging takes place. So that's why rasa is very important in that also. So therefore, when we uh, come across early aging changes, then also we should think about rasa and rasa pradosh. Same way, in Sushruta Samhita also, the list of rasa pradoshaja vyadhi are given, almost the same, similar. So we'll not go in details of that. Like I said, that Sroto Rodh is very much linked with Rasa Pradosh. The same concept is found at many places in the text. Kupitanam hi doshanam sharire paridhavatam yatra sangaha ka vaigunyat vyadhis tatropajate. Sangha. And what is that sangha? In Charak Samhita, it is told that Chipyamana kha vaigunyat rasaha sajjati yatra saha karoti vikrutim tatra khe varshamiva toida. So sangha, when due to vikrut rasa srotorod takes place, then the doshas make sthan saushraya over there and produce the diseases. So rasa dushti is very important in srotorod. That is indicated by all these references. And in Ashtang Hruday, further they have told that pratirogam iti kruddha rogadhishtanagamini rasayani prapadyashu dosha dehe vikurvate. Rasayani. So which are carrying rasa. So in that, when the Srotorod takes place, then various abnormalities are produced. In Sushruta Samhita, again it is told, in the context of Rajakshma, so when Srotorod takes place, we have learned that due to Srotorod, nutrients are not available to the further dhatus, so a disease like Pandu can originate. If that Srotorod is to that extent that nutrients are not available to the further dhatus, even disease like Rajakshma can also occur, according to Ayurveda. Again, for the students who have newly entered into the field of Ayurveda, I would like to say that Rajakshma we diagnose clinically. In those patients, some of those patients, the test for COX may be positive. In some of the patients, the test for COX may be negative. But clinically, if they are having Rajakshma, we will treat accordingly. If the patient is having all the symptoms of Rajakshma, and if his tests of COX are negative, don't worry, you are all right. Your tests are negative, go home. Can we do that? No. Still, from our viewpoint, he is having Rajakshma only, and still we will treat him accordingly. So, our diagnosis of Rajakshma is not dependent on test of COX. That is one way. That is from, so it may be positive or negative, but from clinical view, it may be Rajakshma only. And for Rajakshma, Rasadushti may be or Srotorod may be one important factor, and that's why in Sushrut Samhita it is told that Kapha Pradhaner Doshahi Ruddheshu Rasa Vartmasu. So when specifically Kapha Pradhan Dosh perform, then Srotorod occurs. Kapha Pradhan Dosh makes sthan samshraya over there. Actually, Vaidya Ranjit Rai Desai, so I have gone through important texts on Sharir also for this purpose. So like Ayurvedic Kriya Sharir and Nidan Chikitsa Hastamaloka of Vaidya Ranjit Rai Desai. Then Purush Vichay by Professor Vijay Thakur, Ayurved Sharir by Dhirendranath Banerjee, and so many other books. So in them, Vaidya Ranjit Rai Desai has explained that when kapha makes sthan samshraya, it can actually block that srotas by increasing the quantity over there. But if pitta is involved, maybe due to shoth, pak, etc. changes, Srotorad may occur. And if Vat is involved, then Sramsa Vyatha Vedaswapa Sadharukto Devan Sangangavanga Sankocha. So due to Sankoch, constriction, caused by Vat also Srotorod can occur. So all three doshas can cause Srotorod in that way. So different doshas, but here in context of Rajakshma, they have mentioned that Kapha Pradhan dosh, when they perform Srotorod in Rasavaha Srotas specifically, then the further dhatus, they don't get their nutrients, and that's why Rajakshma may be produced. In Charak Samhita also, Srotasam Sannirodhacha, due to Srotorod, the Samprapti of Rajakshma can take place. But not just Srotorod, Raktadinam Sankshyat, Dhatushmanam Chapachayat. These are also the ways of Samprapti. But in all these Srotorod, Srotasam Sannirodhat, this is also one important aspect of Samprapti of Rajakshma. And how this Srotorod takes place? They have told that Yakshma Karaka Doshena Avaruddhatvat. So therefore, these doshas, they make block the Srotas, and that's why nutrients are not available to further dhatus, and then ultimately Rajakshma is produced. So as I told, I have gone through important text on Sharir written in the present era by eminent authors, and now there are certain structures which are not mentioned directly in Ayurveda. So according to their karma, we will understand them, that what we will call in them Ayurveda. So actually, in the text available to us right now, we may not find all the details about Sharir, because they are not the text on Sharir as such. What we are reading, Charak Samhita, a text which is devoted to Kaya Chikitsa. What we are reading is Sushrut Samhita, a text mainly devoted to Shalya Tantra, surgery. So in Harrison's Principles of Internal Medicine, can we find all the details which are there in Gray's Anatomy and Guyton's Physiology? And if they are not found, we will be say that the authors of Harrison, they don't know about anatomy and physiology, all the details they were not knowing, because they have not mentioned them in that book. Can we say like that? In the same way, Charak Samhita is a book on Chikitsa. Sushruta Samhita is a book on Shalya mainly. Ashtang Sangra, they are, although the name is Ashtanga, but mainly devoted to Kaya Chikitsa. So in that, can we expect that all the Sharir will be given in that book? And if it is not present, can we say that they were not knowing about Sharir? What they have mentioned in the text is applied Sharir, like in the sense. So what we require while treating the patient, that aspect of Sharir is mentioned in our text, and that is very much important, and that in day-to-day practice in every patient we are using it. And that's why Ayurveda Sharir is very, very important for us. This is very important to say on the background of certain articles which are published in certain journals these days. That's why I mentioned about that. So major texts on Sharir which are available to us right now written by eminent authors, they mention that lymph can be considered as part of rasa, and that's why I'm mentioning it. Now, Hodgkin's or non-Hodgkin's lymphoma or various other types of lymphomas, what should be our approach? Is it mentioned in Ayurveda? No. Then what people do, that take the symptoms of all these diseases and correlate where it is mentioned in the text. That means a theoretical exercise, and therefore try to decide a name for that in Ayurveda. That is one way, but more important, what is more important, that when that patient comes to us, when we take history of that patient from Ayurvedic point of view, when we try to understand the condition of the patient from Ayurvedic point of view, what is our diagnosis, what we are observing that in that patient, accordingly we will treat. Now, when we will treat 2, 3, 10, 100 patients, then we will come to know that, okay, in these patients, these are the common sampraptis which are observed according to Ayurveda, and then we will be in a position to say that, okay, in lymphoma patients, this samprapti is commonly observed, and that's why this way in Ayurveda we can describe it. That should be the right process. That means clinically what exactly we are observing, not sitting in a room and comparing the things. Clinically in that patient, what we are observing from Ayurvedic point of view. Maximum number of cases were of different types of lymphoma, and I don't know how Vaidya Ashutosh ji came to know about that, and he gave me the same topic. So there were many cases there, but I am going to present 2 cases over here. So in the cases which I observed in lymphomas, Rasa Pradosh was mainly observed, and that's why this link, Rasa Pradosh and lymphomas. And what we observed in those patients, what were the main findings from the Ayurvedic point of view? That rasashrit, kapha pradhan, sam, grathit dosh, and due to that srotorod, and due to that the further symptoms. That was mainly observed in majority of the patients, and that's why on those lines we have treated those patients. Now I am not going to in details of various types of lymphomas and their description, because that will be available to you very easily on internet also. WHO classification of Hodgkin's lymphoma, 4 major types are described. And for non-Hodgkin's lymphoma, 2 precursors of that, then peripheral B cell neoplasms, 12 types are mentioned, and peripheral T cell and NK cell neoplasms, 13 types are mentioned. I am not going to describe all of them because that information is very easily available, and therefore we need not go in details of that. The 2 cases which I am going to present are of diffuse large B cell lymphoma, diagnosed as that, and therefore this DLBCL is the most common lymphoma, representing approximately 30% of non-Hodgkin lymphomas, and it is rapidly fatal if untreated. And what is the prognosis according to the, if modern treatment is given? For non-Hodgkin lymphoma, overall 5-year relative survival is 73.2%. That is a good figure. So there is a very good survival. But main thing is that the treatments which are given, they involve a lot of side effects. And further, the cases which I am going to present here, they were in stage 4 of those. And according to the IPI score and staging, if you will calculate, then survival chances for those patients were 53%. That means 50-50 chances were there, I think. And that's why those patients opted for Ayurvedic treatment, and what happened that we are going to see. So 2 cases we will discuss. Many cases I have not taken because it may not be possible to discuss about the details of all those cases. So 2 cases I have taken here. A male patient of 39 years. He was diagnosed as retroviral disease, that means AIDS. He was also having AIDS, and he was also diagnosed as having diffuse large B-cell lymphoma. Already he was diagnosed and then he came to me. So in 2013, a lesion was found in the terminal ileum, and that was resected on 20th January 2014. And then they planned for CHOP, that means 4 drugs are taken, and through that chemotherapy is given. That was planned for that patient. But after taking 1 cycle of that, the patient, he decided that I am not going to continue further. And actually that means, in the words of patient, the patient told that if you will force me to take that, I will jump from the window and make suicide, but I will not take that. So then they said that, okay, wait, we will find out some alternative. So somehow they approached me. So he was on Ayurvedic treatment from 23rd April 2014, and then onwards he was only on Ayurvedic treatment. That is also very important. He was not on any other treatment. Any other medicine was not continued for him. So modern medicines were stopped. So what was his history from Ayurvedic point of view? That since 2007, in 2013 he was diagnosed with this thing. But since 2007, repeatedly he was having the complaints like Shudha Mandya, Rullas, Udarashul Gaurav. That means his Agni was not functioning properly. Then as an effect of that, since digestion was not proper, the stools were also affected, because the Kittansh also will not be formed properly, and that's why the Purish also will not be formed properly, and that's why he had Vibandha, Adhovat Pravarti and Kruchrena Pravartan. And as a result, because this Agnimandya was there, and that's why Rasadushti took place, and Rasanimitthameva Staulyam Karshamcha, so he developed Bharakshay. That means he developed weight loss and severe debility, Tivra Daurbalya.